Hello, and welcome to today's mHealth Intelligence webcast, sponsored by Providence and Dexcare, the new healthcare imperative, optimizing access across business lines. I am Vanessa Palma-Desiato, Project Manager at Xtelligent Healthcare Media, and moderator of today's webcast. We will begin with a presentation by our speakers and conclude with a question and answer segment. Audience members can submit questions at any time during the webcast using the question tool to the left of the screen. For all technical matters or difficulties, click the help icon at the bottom of the screen. A recording of this webcast will be made available following this presentation. First, I'd like to thank our sponsor, Providence and Dexcare. Dexcare is the third platform incubated and spun off by the Providence Digital Innovation Group, a mission-driven team of strategists, software engineers, marketers, and investors within Providence focused on uncovering opportunities for digital innovation that further the organization's vision of health for a better world. For more information, visit www.dexcarehealth.com. With that, I would like to introduce our speaker, Sarah Vasey, Chief Digital Strategy and Business Development Officer at Providence, Dr. Sarah Pletcher, VP and Executive Medical Director of Virtual at Houston Methodist, Wendy Horn, VP of Business Development at Community Health Network, Major Pandey, Director of Digital Product Management at Kaiser Permanente, and Amanda Ashley, Director of Operations at Providence Breast Care. Sarah, I'll now hand the floor to you.
Wonderful. Thank you so much, Vanessa. And hello, everyone. As Vanessa noted, I'm Sarah Vasey, Providence's Chief Digital Strategy Officer, and your host today on behalf of the Providence, Dexcare teams and our esteemed panelists. I'd like to welcome all of you to today's session, where we'll be talking about reimagining and optimizing access, and doing so by orchestrating health system capacity and digital demand across all lines and modalities of care, and exploring new models for patient and consumer access, navigation, and optimization. So thank you so much for joining, and thank you to our panelists who I'm really excited to have this conversation with today. So just by way of a bit of context, what's the biggest healthcare disruptor of all time? You know, that's a question that we ask ourselves often. And of course, with providers, this has become a more and more prominent question in our minds over the course of the last few years, with new forms of kind of participants in the healthcare space coming in, folks like Amazon Care and CVS, Aetna, increasingly doing healthcare delivery in a traditional way that we have. So Walmart getting into care. So, you know, we get asked this question a lot, and we think it a lot, and kind of try to address it for ourselves. But I would say, you know, when we think about healthcare disruption, the biggest disruptor of all time in terms of what has accelerated a lot of the trends that we've been seeing for some time that have maybe been lagging in terms of their actual impact on our care delivery business and our ability to care for our communities, has been COVID-19. It has just created a very dramatic shift in the way we think about delivering care, in the way that we think about engaging with patients online and offline. And you know, we've seen such we've experienced things that we hadn't before. For instance, the need to shut down clinics, which is something that many health systems had to do in the early days when we were still trying to understand what is going on, what was going on with COVID. And, you know, with the early science, there just wasn't that much, you know, sort of proven information. So, you know, at Providence, we took this opportunity and these really dramatic catalyzing event that has occurred and is continuing to occur, and took the opportunity to take a step back and say, how do we think about our digital strategy and our care delivery strategy in the context of sort of this new world that we're all going to be in? And, you know, folks talk about returning back to normal. We don't think that that's necessarily going to happen. What's really changing is that care is no longer as tied to just your nearest clinic location. It's certainly some aspects of it are, but we have an opportunity that is non-geographically dependent. And in particular, that's happening because so many folks are now experiencing things like telehealth. Telehealth has accelerated and adoption has gone up orders of magnitude over the last 8-9 months in ways that it didn't for the previous 8 to 9 years, and even more than that. So, we just have this opportunity to, now that we are online, to aggregate patient demand across non-geographic kind of constraints, apply intelligence to match supply and demand, and then optimize access across that. So, really getting the right patient to the right care, matching supply to demand, and ensuring that patients know what that care is for them. So, virtual care has been a change agent throughout this whole thing, and it's bringing about a new era that we think will break down sort of the traditional brick and mortar approach to care delivery. And I think all of the other panelists will attest to this as well. And certainly Providence has seen this. And unfortunately, Amanda Ashley, who is our Director of Operations for Express Care, has lost her voice and is very sick today. So I'll be trying to fill her her shoes today. I have a big job to do, but she would say the same thing as the other panelists as well, that really we're rethinking the way about delivering care, and it's not just brick and mortar based anymore. Some data that we have at Providence that you can see here in terms of our total ambulatory visits across our entire network, and then split out between the different modalities. So you can see that the total number of visits, it's that yellow line up at the top there. There was certainly a dip and in the early days of COVID in March and April, but has steadily increased. And now we're almost to pre-pandemic levels in terms of total care that is being delivered. Now, what you'll notice is a big difference is that red line. That red line represents video visits, so virtual care. Prior to the start of the pandemic, we had less than 1% of our total visits being delivered by virtual modalities. And at the peak of within April, at the peak of our virtual visit sort of delivery, it accounted for over 60% of our total visits. Now that has changed a bit, and it's declined slightly to somewhere between 20 and 30% of total visits. But we've experienced a sea change in terms of the way by which and the modalities by which we deliver care, and are seeing that data sort of play out consistently. As you can also see, it's stabilized a bit, so it's not all over the place. Like consumer behavior, provider adoption, those are all stabilized. In total, the national data suggests that as many as 1 billion visits are going to be conducted in the U.S. Virtually in 2020. We may have already hit that benchmark, actually, and across all health systems, about 50% of their visits were being done by virtual mechanisms in the early pandemic days, as compared to about 10 to 11% last year. So, and then another note is that 80% of the patients using telehealth are doing so for the first time under these conditions. So again, major catalytic event, major disruptive event that we all need to be prepared for. One question we get a lot is, well, what about the regulations? There's coverage, there's licensure issues, there's data and privacy issues, which all under the pandemic have received various forms of emergency use authorizations and other sort of deregulatory action in order to promote the utilization of virtual under sort of very unique circumstances. We anticipate that while it may not fully capture the entirety of what is happening currently under emergency conditions, that much of this will persist over time, and that there will be increased sort of regulatory as well as legislative support for the continued sort of underlying enablers driving the adoption of telehealth. Now, fundamentally, as we see it at Providence, fundamentally, when you start to bring about virtual as part of your core operating model, it opens up the degrees of freedom as to how you can deliver care and which modalities and which venues. And so it becomes much more of a complex supply and demand problem as compared to just a very kind of standard brick and mortar, one patient to one provider delivery model. So we, as Vanessa noted at the beginning, we've incubated a company called Dexcare, which enables us to solve for that complex supply and demand problem. And the other panelists will also be utilizing Dexcare in various ways within their systems that we'll be talking about. Fundamentally, Dexcare is about navigating patients to the right care at the right time that is based on matching supply and demand and optimizing capacity against demand, and ensuring that all of that is sort of presented to the patient in a way that is discoverable and supports them in getting the care that they need. So it's across multiple modalities, whether that modality be video, whether that be chat, whether it be AI powered or not, it can actually support those virtual mechanisms as well as physical mechanisms like care delivery in a clinic or at a home. And Dexcare for us plugs into the existing ecosystem. So Providence has a mobile app that Dexcare is plugged into for on-demand care. There are APIs for web. Patients don't need a separate identity. It hooks into the identity that the health system has in our federated identity management system. Providers get to do everything with their existing login. They don't have to go into a separate system. And that's all partly achieved through EMR integration that surfaces up clinical notes, surfaces up real-time inventory of appointment availability and type of appointment, and brings it forward in the ways that I just talked about. So this is how Dexcare works, and I talked about many of these things already, but it's a really powerful patient experience. So it surfaces up, again, real-time availability, provider availability directly from the EMR across all of the different modalities and types of care, and makes them discoverable. Patients are then routed to the right care based on performance, based on what works for them, based on convenience and other factors. There's also line of sight for the provider to match supply and demand and align staffing to meet those needs. So it's both a patient-oriented routing as well as sort of this care traffic control and resource allocation for providers. And that can be done by leveraging that real-time inventory and the integration into Epic. And then it really it sits on top of Epic. It's not a replacement. In our case, we use Epic. Of course, there are Cerner and other EMRs that it can integrate into as well. So that's sort of the setup for all of this. Really what we're talking about is access optimization and an entirely new way of thinking about your care delivery operating model in the context of a much more sort of flexible way of delivering care that includes video, chat, async, et cetera, combined with physical. So with that, I will turn it over to our first panelist, Dr. Sarah Pletcher, who is the VP and Executive Medical Director over virtual care at Houston Methodist Health System. And she'll talk a little bit about what Houston Methodist is doing around access optimization and we'll go from there. And Dr. Pletcher, thank you so much for joining. And if you could just kind of highlight a couple things while you are speaking, that would be great. Just sort of, how do you see COVID as this major catalytic event and the digital opportunities that have been presented as a result of it? Your digital ecosystem and how you're thinking about access, and how do you see Dexcare kind of fitting in within that context?
Great, thank you so much. So I've joined Houston Methodist right in the middle of the pandemic, so I'm relatively new to the system. But just for context, Houston Methodist is obviously Houston-based. It's an 8-hospital, full quaternary health system located in part of the Texas Medical Center, which, if you haven't been to Houston, is the largest medical center in the world. It's a big conglomeration of 10+ institutions all working together and separately in one space. So in terms of thinking about services from a virtual perspective that span across a large system of care, and thinking about the whole care continuum from very ambulatory wellness-based services all the way through the highest acuity services. There was a lot of virtual activity happening even before COVID, but definitely agree in our experience very much echoed that of Providence, where, when COVID shut clinic operations down, we were able to flip on a dime and switch to virtual and maintain our overall, very close to our overall visit volume by April by leveraging virtual. Like Providence, we've seen a kind of peak around 60% virtual of overall visits, and that has settled down to a bit of at least a temporary new normal that's more more modest in the 30-40% range. So all in, we've done over 300,000 virtual visits just since March of 2020 using a number of modalities. So our current portfolio includes ambulatory programs, like all of our specialist and primary care docs who just simply integrate virtual visits into their practice, as well as our virtual urgent care service line. And we also have a number of hospital service lines. So currently those include ICU, psychiatry, neurology, stroke, infectious disease. So, where we're offering consultative on demand all the way up to kind of 24/7 very robust coverage models. So I think one of the things that I think about in terms of thinking about a system like Houston Methodist, and when you look out at the market now that's had this huge kick in the pants in terms of virtual adoption, is now anyone can offer a virtual visit. So from the perspective of where do we want to be in the market, it's that everyone can offer a virtual visit, but not everyone can offer coordination and orchestration of care. And so for us, virtual had to facilitate that. And part of our journey to realize the benefit of Dexcare is that, as Sarah says, it offers that wrapper to pull patients out of the, from Google, if you will, and all the way inside our front door. But allowing us to stay inside our EMR so that we can facilitate all of the richness in terms of handoffs between different specialists and coordination of lab testing, or being able to be very agile when we're quickly implementing things like we are this week, right, of facilitating patients getting monoclonal antibody treatment for COVID, or figuring out how we're going to support vaccine coordination. So we just began to increasingly realize we've got to drive not only virtual urgent care inside, but we really want to leverage the capability of Dexcare to serve as that wrapper to facilitate entry of patients into the system from lots of points of entry. So, for us, that's how we're looking at it. So I think I'll pause there and we can move on to the next panelist. Did I cover all of your points, Sarah?
You did, and that was so great. And it was such a perfect segue actually into the next section, which I will be again covering, and I have big shoes to fill for Amanda. So, but it is, you absolutely hit on the a couple of interesting points, which is one, it's so essential for we don't just think about it as virtual as a standalone, but really as a part of an offering that connects into your operating model. And also you made a note about multiple points of care all kind of coming in. It's not just about a single front door even. We hear the term digital front door quite a bit, but there isn't a single front door. There's Google, there's your own website. There are all these different potential points of entry, and making sense of those, aggregating that demand, and then doing the right things with it are absolutely critical, and actually very similar to the experience that we've had at Providence. And so I'll speak a little bit about what we've done here, which is that, the first, where we are kind of now, and I would say we're somewhere between here, what you see on the left at now and where you see next. We're somewhere in the middle, which is access is absolutely essential to every health system in terms of being available to our patients and getting them the care that they need, and driving patient acquisition for our systems. So we stood up a lot of different access channels, and we opened those up. But now, how do patients make sense of it? And how do they actually get into the care that they need in a sensible way without saying, okay, well, what do all these different things mean to me? And that's one of the ways by which we've started to deploy Dexcare. So we're very consumer centric. So coming at it with the model of, what are patients looking for? Why are they looking for it? And how do we get them into, convert into the care that they need? So that allows us to focus on optimizing and growing at scale and being and then that, of course, if we can do that, we can be nimble and responsive to the disruptors that I talked about at the beginning, like the Amazon Cares of the world, and Optum, which is like a major entrant into many of our markets. And so it also gives us, this sort of leverage around new approaches with respect to digital, as well as the degrees of freedom that it opens up around different modalities. So we're sort of, we're heading into this sort of next phase here, which is how do we have almost a digital first approach, but that it gets folks to the right place, with the future that it's really right care, right time, right place, and right price. And affordability, of course, is a massive issue in healthcare. And that factors into how we route patients and get them to the most appropriate setting for their condition that is higher value, as opposed to a more expensive location for care. So, I'll talk a little bit at the very end of this about some of the results we've had, but there's also been a huge focus on access for new and commercially insured patients that are essential to our business model, and creating this amazing NPS experience. So we really have NPS that is world-class and on par with some of the great, service-oriented, customer-obsessed companies in the world. So I'll talk about that at the end, but this is our vision for it. It's taking this very fragmented ecosystem of care, making sense of it, and routing patients in the right way, making it easy for providers too. So it's not just we're doing this at the expense of the provider, but there are dashboards and tools that we have in place to make it very easy for our providers as well. With that, I will go to our next panelist, Madhur Pandey, who is the Director of Digital Product Management at Kaiser Permanente. And Madhur, just please feel free to tell me when to go to the next slide.
Yeah, sure. So, Sarah, I am not able to see the slides, but if you're on the new normal, I'm good, and we can run from there. Okay, awesome. Yep. Hello, everyone. And like Sarah, you said, and Dr. Fletcher mentioned, COVID is one of the biggest health disruptors. And we are expecting this pivot to what we are calling the new normal. And I think I am hearing it through what you said and what Dr. Fletcher said, which is around consumer expectations, right? The behavior, the preferences and expectations are here to stay well after the pandemic. So the pandemic has shaped it to a large extent. And the three trends that we at Kaiser Permanente are keeping front and center as we redesign and rethink our digital experiences are the first one being contactless interaction, which correlates to safety and remoteness, which is top of mind for our consumers today. And so as we are designing and rethinking digital experiences for the future, that has to stay, right? The second trend is all around care navigation. How are consumers understanding which care option is right for them? How do they get to the right appropriate care? It also needs to be front and center as a trend as we think about our future digital experiences. And lastly, the third trend is around just the digital health platform. And we have seen a surge, rightly so, year over year in usage of our KP mobile app and bkp.org. And we believe that it will continue to be a digital anchor for patients along their health and care journeys. So these are some of what we anticipate as the trends that are here to stay. Moving on, Sarah, if you can go to the next slide. I wanted to touch upon what is the strategic aim for the KP Digital. And it is, like you said, right, transforming care with a digital-first mindset. And what that means is that we have two primary goals to accomplish within KP Digital. The first being that we want to guide and anticipate our member needs so that we are making it really easy for them to find the KP resources and tools that they need and want. And the second is that we want to embed digital capabilities like AI and machine learning into our clinician workflows, allowing our caregivers to provide high quality, personalized, and timely care. And so to do that, we have these three key strategic elements. The first one, as I said, digital first mindset. Consumers are using technology. Technology is here. You mentioned that there are many technology disruptors in the healthcare space right now that are pushing the envelope on how healthcare can be provided through a digital platform. At Kaiser Permanente, we have 76% of our member base that is digitally engaged, and that is setting the stage for us to align with their needs. The second element is evolving consumers. You also briefly touched on it, and that's true that consumer needs are ever changing. They are expecting more choices. They are expecting higher quality care, and what they're looking for is an easy way to access care. They're looking for convenient health solutions. They are looking for a personalized, customizable digital healthcare platform. And then finally, the enhanced care experiences. Taking cue from other industries, players in the healthcare landscape are also looking to augment their existing care services using strong data insights or data-driven insights. So to implement what we believe to be our strategic aim, we have, if you don't mind moving to the next slide, we have come up with what we are calling the 5 distinct focus areas. And just to tie it to what you just said, care, there are multiple touch points. It's all about what is the care journey for the consumer? How are we pulling these elements together? How are we creating a cohesive experience that is personalized and applicable to that consumer at that moment, right? The care journey for a person who is recently diagnosed with diabetes is very different than a person who's managing diabetes, right, as a chronic condition. So how can we at Kaiser Permanente leverage the information we have, the member base we have, our clinical force, the technology, and pull it all together to create a cohesive experience? And to deliver on that, we have what we are calling these 5 distinct focus areas. The first one is modernizing our digital platform. So we want to make our KP mobile app and kp.org more scalable and modular so that we can deliver on contextual personalized experiences that I just referenced. The second one is powering digital care navigation. This one is to drive intuitive or navigate our members to the right care options using AI-driven guidance tools. The third one is accelerating virtual care offerings, which is all about connecting our patients and clinicians virtually through healthcare platforms, leveraging our remote monitoring offerings and different health management solutions. The fourth one is to digitize in-person care experiences. And as the name says, it's to take care of an end-to-end experience of a patient or in their in-person care journey. And it's about helping them by providing them with tools and resources so that they can prepare for every step of their upcoming visit, whether it is before the visit, during the visit, or after the visit. And last and not the least is enabling seamless transactions, which is creating a seamless, frictionless way for our members to complete their self-service transactions, such as billing, and also making it super easy for them to find their health plan information, their benefit information, etc. So where we see Dexcare, and you highlighted a few of the main points that makes Dexcare very attractive for us, which is the integration with electronic medical records, because that's our source of truth, that's what our physicians use, but also being the single solution that can navigate to different care modalities that our consumers need or our patients need. So we see Dexcare playing a role in helping us in achieving our goals around care navigation and also in improving and enhancing the virtual care offerings that Kaiser offers today, and pulling it all together so that it becomes a very easy, intuitive experience for our members. Back to you.
That's wonderful. Thank you. I love what you said. And this is such it's such a clear and really compelling framework. And, you know, it speaks to the power of the need for a consumer-oriented or patient-oriented front end, as opposed to just a repository where all your stuff goes and where, you know, that isn't patient friendly and doesn't help patients or consumers really understand what their options are, navigate them to the right place, and actually convert. I think that's a big challenge that this really addresses, and it's an amazing framework. So really appreciate that. Finally, I'm going to turn it over to Wendy Horn, who's the VP of Business Development at Community Health Network in Indianapolis, and she's going to talk a little bit about what they've done at CHN. Oh, Wendy, you're muted.
Thank you for that prompt, and thank you for the introduction, Sarah. I guess I would just start with saying, when the challenge was given to us about what can you say about the why for Dexcare and why at CHNW, I thought I should sort of start with our story. And here's a slide that we're sharing with you that might resonate with a lot of health systems around the country. So I represent a health system, pretty robust health system, that's essentially a single state health system, but we're a very significant player in the state in Indiana. We're $3 billion, actually about $3.6 billion organization. We see about 2 million in patients a year. We have 200 plus sites of care. We have one of the more robust brands in urgent care and a pretty robust retail model, considering our competition. And so at the end of the day, you know, for us, it's all about platform. So we actually were starting the journey on developing a platform which allows multiple players to connect with us before we started talking to Providence and Dexcare about how they might help us on the aggregation side. So at the end of the day, we look at a way to be relevant for us health systems in the future is we have to be the aggregators, the navigators, and coordinators of these services. There is disruption coming at us every place. And if we can actually be the steward and the caregiver and look at it within the health system and providers and the business people and the billing people, that if we recognize that our role is changing and that the consumer is demanding digital access, and we can create a platform, call it a marketplace, connecting folks that want to buy or opt into a service with that actual service, that we will continue to add value. And that's our job. We have to add value to our customers. They're our patients. So one of the things that was really compelling to us in getting organized around Dexcare and having them as a partner, and we look at them as a partner, is not just the talent they have. So be clear, health systems on the phone, if you are not a multi-state system provider, you only have so many capital resources. So we underwent a build by partner analysis to look at whether or not we wanted to build essentially the aggregation and demand platform essentially at Google. Did we want to build that on our own? Did we want to partner it? How did we want to do it? And we always were a clear purpose that it would have to connect into our platform, with some of our goals being new patient acquisition, frictionless experience, and conversion to MyChart. So MyChart is something that is a critical part to our delivery of care. And so Providence / Dexcare, as Sarah mentioned, not only is Providence an Epic shop, they walk our walk with Epic every day. So in our due diligence, we felt very comfortable that they could understand our imperatives as related to our EHR and all the services that Epic provides us. So we have essentially a shared ecosystem when we have folks take a journey on the Dexcare platform, where our people focus on, if they are a new patient, what can we do? How can we reorganize our work differently to help convert them to a MyChart patient? Because once they do that, they are officially in our ecosystem. They're no longer a transactional patient to us. And then how can we support and add value to that established patient thereafter? There will be those patients, and we've seen that through COVID and pre-COVID in all of our retail sites, that will prefer to be transactional patients and customers until they really need continuum of care. But this also allows us to manage that interaction and that experience until they decide they want to be part of our ecosystem officially. So for us, it is all about the platform. I agree very much with what Dr. Pletcher said, what our role is. The navigation coordination is important. We're working with providers, understanding how their role is changing. COVID did us a service in the digital adoption standpoint. Our job now, as Dr. McGill, our chief analytics doctor and a physician says, is to hold that percentage of virtual that we're getting and to skill up and train more providers so that we can hold and grow. And we want to give our patients options for where they want to be seen, when they want to be seen. So we are continuing to grow the percentage of visits that are occurring virtually. But I think our bigger message today is we really view Dexcare, Providence as partners. What they built is a platform that will connect into ours. And they also have, again, the developers, designers skill set, being from the coast and we're in the Midwest, that we knew that we could get the talent, and a partnership was the way to go.
Excellent. Thank you, Wendy. Again, a lot of really great points. And I love your story and the platform because it really shows the importance of, we always talk about at Providence the notion of the sacred encounter, which is when the provider and the patient are together and the patient is getting the care that they need. And that's fundamentally about bringing the consumers and the producers together in the most important way, and getting rid of all of the friction and everything else around it and the difficulty of getting to that sacred encounter. So I just think that that's such a clear-eyed view of like what's important, which is removing the friction, getting folks to the right place at the right time, and doing so in a sort of a very consumer-oriented way. So thank you all for your kind of overviews of how you're thinking about this. And Wendy, you just touched on something that I wanted to also ask Dr. Pletcher in terms of how you're thinking about this within Houston Methodist. And you mentioned this around this notion of sort of many front doors, which is related. But of course, one of the advantages of a platform like Dexcare is having one solution that can service all modalities of care across all venues. So you don't have something operating in your physical environment, another thing operating for video, another thing operating for chat, but it's all modalities, all venues kind of integrated fully into the EMR. Can you talk a little bit more about that in relation to the direction that you all are going at Houston Methodist, and how that requirement may have changed post-COVID or become, or accelerated?
Sure. Did you want me to go first?
Yes, please.
Sure. So yeah, I think one key element for us, we had a virtual urgent care solution using a vended platform outside of our EMR pre-COVID, and in terms of having that on the shelf for consumers to come through, it achieved that goal. But once we hit COVID, it really amplified that lack of ability to coordinate care. Having the inability of the back end to order lab results, to communicate with other physicians, to route orders, to route notes, to tee up COVID testing or treatments. And I think as we've had to pivot into a much more expanded and dynamic reimbursement landscape, there again, anytime we're outside of the EMR, we're fragmenting that care delivery. So I think COVID has made us all be more nimble and more agile. Which is great. I think for a lot of us, we know how to provide excellent care to our patients, but we don't necessarily make it easy for them to get inside the house, right? Once they're in there, they're going to have a great experience, but getting in can be hard. And I think, we've depended on the loyalty of our patients to carry us through, but we're in a new market now where their expectation is that it shouldn't be so hard to get inside the door. And if it is, they'll find another door. So I think both COVID in terms of how it's impacted consumer expectations of experience and wanting to do things from home, whereas before there was more acceptance that, well, I guess I have to go in. I think both of those things are huge impacts on why we need an ecosystem that allows us to meet consumer expectation, but also be agile and nimble and integrated when we're trying to coordinate and orchestrate a much more dynamic care landscape.
That's a great analogy. Don't make it so hard to get in the door. I think where we are kind of at right now is maybe it doesn't really matter if there's a door, if the door is locked, or if the doors are here, but there's also 7 other doors that say enter here, and it's very confusing, or a door opens into your, a garage or something that isn't connected to the house, So I think all of this analogy is really, really important and shines a light on. It needs to be clear where you can enter, and then that where you enter has to be connected to other things. I just think that again, that kind of gets back to this concept of it's really difficult. It's more folks are online now than ever, and so it's a less familiar landscape to them than previously, where you just went to your doctor's office. And so being able to manage all that in your core operating model is essential.
Right. And there's nothing more gratifying for those of us who've been toiling in virtual for decades to have the sort of cranky patient who would never dream of doing anything online pivot in a day to now I want all my appointments online. That's a great adoption success, but it also is an expectation driver, right? Those patients are not going to put up with, sorry, you have to come in the way that they used to. So, sometimes be careful what you wish for in terms of trying to drive adoption, but it does necessitate having tools that can keep up.
Absolutely. And, I think you also just brought up another kind of competitive point around just the disruptive landscape, which is when so many folks are now online and booking online and doing things and their expectations are changing, they're also ripe for being sort of grabbed up by others. And so if we fundamentally believe in the relationship that we want to preserve with our patients and our consumers, then we our patients who historically maybe were more loyal are now kind of like this notion of a free agent, and so we have to be meeting their expectations in order to maintain that relationship. Madhur, I'll kick this one over to you, this next question. And you talked about this a little bit in your framework, the kind of the 5-pronged framework that you have, but Dexcare is a platform that focuses on 3 areas of the experience. acquisition, navigation, and capacity optimization. Can you talk about how you're thinking about those three things within of your transformation strategy and within the context of that sort of five-pronged framework, and how each of those three components is important for your organization?
Yeah, absolutely, Sarah. So of the three that you mentioned, patient acquisition is less so, but obviously, as you guys are talking about, right, sustainable growth through loyalty and making sure that we are providing our members the experience they need and they want and they expect so that they continue to come back to Kaiser Permanente is an important aspect. Navigation and capacity optimization rank a little higher than patient acquisition for us, right? Just based on our business model. Navigation, again, a lot of research that we have done in this area, and some of this work even started before COVID, and COVID just brought it or accelerated. A lot of work is around that. Kaiser Permanente today offers a very robust portfolio of care options. We offer chat with a physician, we offer video visits, we offer advised nurse, we offer scheduled telephone visits, and as well as in-person appointments. But I think over time, we ourselves have trained our patients to just make an appointment every time there is a problem. And so shifting that, but at the same time, understanding that there are different needs based on their symptoms, and guiding them through that experience and leading them to the right care options and giving them the right information so that they can make a right decision for themselves. Meaning they can do a video visit at $0 copay, or they can see their preferred provider in 30 minutes in their preferred location, or they have an option to do a chat or a video visit right now, right? So providing those options so that they can make the right choice for themselves, which is where navigation plays a key role, and Dexcare, what it offers as a solution leading to all these care modalities, is a very important partner in how Kaiser Permanente is thinking about this experience. In terms of capacity optimization, I don't know if you covered it in your presentation, but there are these different regulations that have gone into effect, right, which allows physicians to take care outside of the state. So the license is not tied to the state. And again, Kaiser Permanente being present in 7 regions, and our clinicians, I think it was Dr. Kaiser who mentioned that it's no longer just them doing face-to-face encounters, right? They are also they are kind of dividing their time between, oh, this is my video visit time and this is my in-person appointment time, and managing calendars. So having that pool of clinicians that is not tied to a location, but is across multiple locations, and that capacity management, that supply and demand matching aspect of Dexcare is also very attractive as we think about the experiences we are building in the future.
That's great. Wendy, could you also talk a little bit about how those three different things kind of come together, acquisition, navigation, and optimization in the context of CHN? I know you all are in a very competitive market, and so I'm sure you've thought about all three extensively.
So again, just for our health system partners out there, it is all about essentially a platform and a model, or a front door, a digital front door to enter that is an appealing experience, frictionless, let's say three clicks to book the modality where you want to have an appointment. And we think that the experience rules. So back to where we're focusing now, we have tools and digital tools in our platform that are measuring the experience from the first click at Google to access us. And so the connector here for our health system partners who are listening on how all this happens and why it matters is, so our framework is for all of these connecting points, the new patient acquisition, or essentially what we just call increasing digitally enabled visits. So one of our metrics is digitally enabled visits. Is our brand promise in this network, which stands out and resonates with a lot of folks, is exceptional care simply delivered. So our framework for this digital acquisition to Community Health Network is at every point that we touch that patient, do we make it easier for the patient? Do we make it easier for their family? Do we make it easier for the provider? So my co-panelists have brought that up as well too. But the experience is going to be measured in a more meaningful way now than we've been able to do it in the past because we have the digital data to do it. So we haven't always had that. And so that makes it much more exciting and palpable. Traditional health systems are all about fixed costs, fixed structure, bricks and mortar. We are moving to digital first. And that fixed experience also has got to change for the patient. So that is why we're doing this, and it plugs into our bigger sort of brand promise for exceptional care simply delivered.
You bring up such an interesting point, which we haven't really talked about yet, but just the amount of data that is unleashed by bringing customers online, and then the ability to use that data to create really amazing experiences, to get folks to the provider that's most appropriate for them, to reduce the burden for the providers themselves. I think you bring up a really interesting point around data that maybe we can hit on that a little bit more in the Q&A around how you're using that. But I want to kind of pivot a little bit and ask all three of you this question just quickly. We're talking about something that's fundamentally transformative for organizations. And often digital innovators within health systems may face resistance there when transformation's on the table. And there can be some functions in organizations that are harder to convince. Maybe like the team that is responsible for deploying your EMR. And they may say, hey, the EMR does all of this, for instance. Do you have any advice or insight on how you've been able to successfully navigate that and move other more resistant parts of your organization toward this digital consumer-oriented mindset? Dr. Pletcher, I'll start with you.
Yeah, I think obviously it differs based on your stakeholder group. And the analogy I sometimes make is, when you're the Girl Scout pushing the cookies, sometimes you got to pull out the Thin Mints, sometimes it's a tag along. It just depends. But some kind of common themes there are, I use a lot of analogies, I use a lot of visuals, and let's draw it on the whiteboard. Another thing that I think is familiar is to keep showing the parallels between what we're doing virtually and other things that happen in person. You'd be surprised how obvious that seems, but when people get uptight about, well, what about this and what about that? And you're like, well, what happens in the ER? What happens if the patient walks into a brick and mortar urgent care? And a lot of times that helps to recenter the conversation about the clinical care we're delivering instead of all the aspects to a new workflow that makes them uncomfortable. I think when it comes to physicians, there's sort of common themes for that whole cohort. Obviously, by tribe and by individual, they're different. But, it tends to boil down to making sure that you neutralize three components: time, kind of productivity or money, if you want to put it that way, and technology. Whatever you're asking them to do can't be a waste of their time. It can't be a loser for them from a, productivity metrics or compensation perspective. And the tech has to be basically reliable. It doesn't have to knock their socks off. This doesn't need to be a huge revenue gain for them, but you at least need to neutralize those three things. And then from there, you're getting into what resonates with that particular physician or physician group around a way that they want to deliver better care, attract more patients, do research, improve their outcomes, do something cool they can write up in a journal. So, you can go into those amplifiers, but at least for the physician population, you got to nail those three components, in my opinion, anyway, to get them on board. Of course, COVID kind of leveled the playing field quite a bit, but at least in the old pre-COVID days, when you had to get buy-in, you had to be more, had to have more ninja skills than you do now in the post-COVID era.
Yeah. Madhur, can you speak a little bit about how you've collaborated with your Epic teams and other IS teams to kind of convey the value proposition of thinking about access a bit differently and doing this kind of work?
Yeah, absolutely. Great question, Sarah. So if I reflect back on my entirety of my career, I've applied technology to look for solutions to solve for our everyday aspects of our life. Change and transformation in general is difficult. And within Kaiser Permanente, being a complex organization, it's harder. But I have to also say, on the other flip side, with our scale, right, there is an eagerness and openness to change because technology is the way where we can meet Kaiser's mission of affordable quality healthcare. So totally agree, like based on different stakeholder groups, there are different incentives, there are different ways to convince. At Kaiser Permanente, keeping the member health outcomes as the front and center for the work that we are doing, whether it is with our IT team, whether it's with the product organization, whether it's with the health plan teams, and with our physicians, really works well. And then with the physician group, they are focused on providing quality care. So anytime, any initiative we are bringing to them that helps them drive that outcome in a more efficient way resonates really well. And then there is a willingness, and I would say almost eagerness to try it out. What has really worked well for us in the digital team is moving away from solutions to focusing on what the problem is, right? So using a problem-centric framework and then moving to outcomes and showing the values, moving away from multi-year projects that take a lot of time and effort to something that we can deliver quickly and show the value on two fronts, right? Member outcomes as well as physician efficiency. And that allows us and builds the momentum to keep building on that digital roadmap and the strict strategy that we've laid out.
That's great advice. And Wendy, how about you from your perspective? How have you brought folks along?
Yeah, so change is hard. Everybody recognizes that. In a health system, again, we're very process-oriented and very fixed-oriented. But I would say that a couple of important key things, again, I'm really speaking to our friends in the health system business who know exactly what I'm talking about. So for change management, we can't make it about the technology. It has to be about the platform. So we have to get certain leaders get certain leaders engaged, and they have to be effective leaders in change management. So in a health system, lots of times somebody's in a great position, in a leadership position, but they're in a leadership position for the wrong thing. So you have to get effective leaders that understand essentially the platform and the purpose. We build a platform with purpose. So you got to get the right leaders in the right chairs to help with that. The compensation model is an issue. So, unfortunately, our traditional payers, et cetera, you touched on it early, Sarah, compensation issues. So be creative. If you've got some docs that are willing to take on 50 shifts for virtual, figure it out. So you just have to be, nimble. And no, it may not be the exact same of your RV views and somebody who wants a different traditional model, but, all legitimate sort of obstacle stones in the road, but figure it out. We're working to a gig economy. We've got doctors who would rather be on-call, flexible. Maybe they'll be only virtual. Think of the concierge models that are out there. So definitely the compensation is an issue. You don't want that to be an impediment to your progress.
Great. Again, really awesome advice. I'll move us ahead. Of course, I think probably the folks that have attended this webinar are wondering, okay, so all of this is just sort of talk until there are some actual results, right? So I'll talk a little bit about the results that we've had at Providence since we have actually deployed Dexcare within our environment for over 4 years now. So, one thing, Wendy, actually, you mentioned this notion of digitally enabled visits. We also look at digitally enabled visits. And within the context of Express Care, which is the initial use case that we where we deployed Dexcare, 75% of what came in to Express Care, which was a combination of same-day retail appointments, virtual visits, 75% of those were digitally enabled. They were either booked online or they were conducted online. That's huge. And, that actually gets to the notion of commercially insured. So the commercially insured patient is the digitally enabled patient. And 70% of the patients that came in to Express Care were commercially insured. And, we are all committed to serving our communities in an equitable way. And in addition to that, we also have to ensure that we get commercially insured patients in through our doors to maintain our financial viability. So that 70% commercially insured number is very important to us. 32% of those folks were net new to our system. So that means, we had never seen them before, and we're using sort of the traditional CMS definition of seeing a patient within a 3-year time period. That means these folks were just out in the wild. They didn't have maybe a primary care provider. They hadn't come to our health system at any given point in the last 3 years. And 30% of them, of the folks that came in through Express Care were new, 32%. Now, there's a bit of a myth that we busted with all of this, which is that a lot of folks say, hey, these are healthy patients that do not have any additional needs. And so, you're getting a small amount of revenue for them, but really they're not contributing to your overall core for your health system in terms of downstream revenue. And what we found was that not to be the case. So on average, we experienced $892 of additional downstream revenue within just the first 90 days after patients were seen within our system in an Express Care setting. Now, $892 might not seem like a lot, but that 32% of net new patients amounts to almost 21,000 unique individuals in the last 12 months. That is almost 19 million in incremental, completely new revenue to our health system, which is absolutely, it's a tremendous sort of business case for us for being able to, and a return for being able to do this. And then finally, 96 and patient NPS. So for folks of you who may not be familiar with NPS is a measure of likelihood of recommending a service, and it's on a scale of positive 100 to negative 100, meaning the folks that are, if they were to say, I'm a detractor, I don't think I would never be like, I would not recommend the service, they would get a negative 100. Positive 100 is a perfect score. 96% is higher than the NPS that Apple and Amazon and, these really world-class consumer-facing companies have. So people love the service, and it has been really powerful for them in terms of getting them the care that they need. And so those are some of the, kind of, I would say, patient acquisition and growth oriented metrics that we've demonstrated within the system. In addition to that, what I would say is there are a lot of operational efficiencies that Providence has benefited from. Medora, you actually talked a little bit about this notion of a shared provider pool. We've also deployed a shared provider pool and enabled it using Dexcare. So that means there's one single provider pool that can be allocated in a very flexible way for video. What that means is much more efficient utilization of that provider pool's time. And so we are actually able to have fewer providers to care for a much broader kind of patient base. Another operational benefit is that because we have this fully integrated digital ecosystem, we're able to really get some interesting scale opportunities. One, for instance, is in this notion of a patient registration representative. So these are the folks that kind of get the individuals signed up for their virtual visits. One PRR, that's the patient registration representative, one PRR can service up to 20 providers and 80 consumers at once, which is a very dramatic departure from the one-to-one MA at the front desk kind of model that traditionally, health systems have deployed. And also because of some of the algorithms that are running in the background and doing the patient to provider matching, our PRRs are only spending on average about 50 seconds greeting patients and getting them in the virtual waiting room and checking them in, completing things like insurance verification. So 50 seconds leaves a lot of time for the actual meat of those visits, right? A lot of efficiency. We've also seen reductions in call volume, which there's real expense associated with that, and a whole host of other operational efficiencies. So for Providence, this has been a tremendous boon in terms of results, driving growth, driving new customer acquisition and commercially insured customer acquisition, as well as downstream revenue and those operational things we just talked about. With that, I'll turn it over to Wendy too. Just, I know you all are still working on getting Dexcare deployed, but how are you thinking about your KPIs and your success metrics? You mentioned a couple. You mentioned, of course, the number of digitally enabled visits, but what are some other examples?
Well, a couple of things. We are in the middle of deploying and standing up and agreeing on those metrics. So you'll get the inside baseball today, and we're landing on those. We hope to finalize those in the next week. We have essentially a pretty significant kickoff for the project on Friday, and we're looking to launch in Q1 of 2021. So number one, obviously, percentage of digitally enabled visits, how many are we moving to there? Growth in virtual care. We want to get back up to maybe not full on the 60% that I think that was described earlier, but we want to continue to grow that off of a baseline of 25% or something like that. We are going to look in growth in downstream revenue, but we're working on new models. And I know a lot of my health system executive partners are looking more closely now at the lifetime value of a customer and a patient. So we know that there's going to be a compounding in that issue if we do our job with navigation coordination and creating, like Matt had talked about, that loyalty. So we'll continue to look at that, but downstream revenue is obviously a metric KPI to look at. And then again, my chart activation, because it's tangible. We do a lot with Epic, and I presume everybody here does. Now, if you ask me in my strategy hat, I'd say that, there's some disruption coming there. But for the time being, we do a lot with Epic, and our patients are doing a lot more with Epic and MyChart. So that's a very granular KPI. And then the patient and provider experience. We want to measure both. We're not looking about just frictionless for the patient. It's got to be for the provider. Again, Dr. McGill, who's sort of my counterpart in leading this within the organization, this transformation and driving the development of our platform. Both he and our CFO says, we want to continue to be one of the top employers for the state. So we employ a lot of physicians. It's allowed in our state. We want them to stay friends. We're a physician-led organization. So the provider experiences, we'll measure that as well. And then the last is partner performance. So a lot of people wouldn't think that, but I mentioned early on that we look at Providence and Dexcare not as a vendor, as a partner. So we'll look at that, see how we're performing, both parties, on that.
That's great. And a perfect segue into something that that has come up in the Q&A that I just wanted to kind of pivot toward very quickly and ask each of you. So Wendy, you just talked about the provider experience. And we've focused primarily in this discussion on the patient experience. But of course, when we're talking about changing the experience, providers are really essential in all of this. And Dr. Pletcher, you mentioned, like, when we're talking about engagement with providers, there are some really basic things we have to do. And then there are some amplifiers. How are you all ensuring that, what are some frameworks or best practices that you're thinking about in terms of, we want to be more consumer centric, and also we don't want to add burden to our providers, and we want to make their experience really great. So, how are you all thinking about that? Dr. Pletcher, let me start with you on that.
Yeah, I was thinking about this as you were speaking before, that, one of the other new realities for us in health systems in our new market is a recognition that there are new roles and new services that we need to provide, whether that's, and sometimes I think of it as conciergification, right, where now every health system has to do a little bit of that, and we need a platform to support that. So Dexcare allowing you to slot in a virtual MA or other members of the care team allows us to achieve on that end. But I think at the end of the day, whenever you're trying to do something slick and seamless and with technology, there's going to be complexity. There just is. So then you're looking at where you're going to push the complexity. And your choices are to push it to the patient, which I think all of us agree increasingly needs to be avoided, even more than it always was. We don't want to push it to the physicians. We want them working at the top of their license. So, it's got to live somewhere. And I think that's where some of these new roles to coordinate and smooth and hand off and direct traffic and optimize really come into play, and where we need ecosystems that will support that, because some of our legacy systems like the EMRs, are great at doing what they do, but aren't known for their agility and breakneck speed in terms of adding other feature sets.
That's great. Madhur, how about from your perspective, how are you all kind of thinking about preserving the provider experience, and what best practices are you going to be deploying?
Yeah, so like Wendy said, right, our physician partners are in lockstep with the digital team. They see digital as an extension of care. Physician operations team and physicians are a key stakeholder for us in every member-facing experience that we are building. So recently, we transformed our KP Digital organization, and we identified 4 key stakeholders within the organization. One is consumer, second is clinician or care provider, third is our employee broker, and fourth is our employees. So by putting clinician and specifically calling out our care provider as stakeholders starts giving us that framework, a starting point. And then we have created a taxonomy that is experience-based for both our consumers and our care providers. So understanding and working with them to understand what are the experiences that they are trying to drive. Is it about what happens when they are taking care of a patient, whether it's virtual or in person? What tools and experiences do they want to drive? What is the prescription and management of medication experience? And what tools and communication channels they want within that experience group? So we have used this taxonomy framework, and we are operationalizing it through what we are calling persistent teams. So we are moving to a very product-centric organization. We are talking about having a persistent group of people that are focusing on these experience groups, and we have stakeholders alignment from physicians to the experience groups to the experiences, all the way to the developers that are developing and testing and delivering the products.
Wonderful. And Wendy, let's wrap up this question with you. How are you all thinking about the provider experience, and whether it be in the context of Dexcare or otherwise?
So the provider experience right now is focused on wave 1 and that dedicated pool for virtual. So we're using this, we're trying to get more of a push adoption now, since we got a lot of adoption through pull transformation during COVID for those visits. So we're having a lot more luck and continue to drive the interest in having folks raise their hand and providing tools to skill them up. I mean, if you think about what some of the impediments are in adoption to begin with, it's fear. I don't know how to do this. What does this look like? So we're trying to skill up, provide essentially a lot more exposure to those opportunities. And we're making people, aware we have to deal with the compensation issue. If it's an RVU doc, what does this look like? So we're focused very granularly on a small group of folks, physician providers, who adopted early during COVID, and we're using them to spread the word define the skill up, help us improve the business model, we're doing that first. Now, remember, Dexcare is a slot-based system. So right now, a lot of the work is really where we have slot-based visits available. So it's virtual, which we know has intrinsic efficiencies that we haven't even tested yet. And then it's your urgent care clinics and then your convenient care clinics. We have a portfolio of convenient care clinics with Walgreens that we run the primary care in there. So we're working on that, but it definitely is provider first.
Great. So we're almost out of time, but I wanted to add in a final piece around sort of hopes and aspirations, or something that, we can think about that's perhaps a silver lining in everything that's happened in the last 8-9 months. And not only has COVID, of course, been very, very tragic and had tremendous toll across the country in terms of lives and the economy, but it has also really exposed things in our system that have existed for some time, but are really evident now. For instance, the notion of how inequitable our healthcare system can be, and how important health equity really is. And so I wanted to kind of close with your thoughts on how do you see. Do you have any thoughts on how digital might be part of overcoming some of these this lack in health equity, and perhaps how can we think about digital in terms of closing the digital divide, which is that digital typically tends to serve those who have the means to be served by digital already. So maybe we could just talk a little bit about that, just close out with each of you. How do you think digital can be used to overcome the disproportionate impact of access challenges for your communities? And where do you think we can go from here to achieve more health equity using technology? Madhur, let's start with you really quickly, and then we'll go around.
Yeah, absolutely. So, Sarah, great question. Kaiser Permanente's mission is all about affordable, quality healthcare for all. And I want to emphasize all, because what you just said did expose where the underserved in the society are the ones that are feeling or are being left behind in terms of how do we provide them access, how do we get them back into the fold of healthcare and getting them the right care. At Kaiser Permanente, before COVID too, there was a lot of focus around socioeconomic determinants of health, risk population. There are a lot of leaders that are leading the way in that. And it has definitely accelerated the digital focus around these folks. We have realized that their main points are that there is no standard way of doing any sort of health assessment for them. Even if there is a way to do a health assessment, the whole process of requiring or requesting these services is very hard, and there is that issue of health literacy many a times. And then lastly, there is no good standard way of connecting the people in need when you are homeless or you don't have enough food on the table, connecting them with the right resources. And many a time it falls on our case managers to take that burden, making the phone calls, connecting the people. And that's where we do see digital playing a huge role. So my hope and dream coming out of this COVID is that we do accelerate our offerings in this space and are able to take care of this very vulnerable segment of society and make healthcare affordable and accessible to them.
Yeah, those are great examples. I love it. Wendy, how about over to you?
So adding a little bit to what Madhur said, so the folks with less resources, we have a team that's focused on how we can get more care to them, and digital literacy is a big issue, and access to digital. But the funding's got to follow it. So we have some community health centers where we do some digital training and education so we can show how people can access it. But we also essentially have a great relationship with the head of CMS. Seema Verma came from Indianapolis, and we're working hard, particularly as relates to Medicare funding, home care. Community Health Network has the largest home care operation in a 38-county area. A lot of those folks are low resource folks. So the funding has gotta happen and follow. And to the extent that we can help push that, we will help push that. And then just lastly, if we follow our brand promise for exceptional care simply delivered, and we create great experiences and skill up for the providers and the patients, we know that we will help enable adoption for the entire community, not just our system. And we look at that as a bigger ecosystem and a bigger hope beyond our network, its walls, and digital ring.
That's awesome. Yeah, great examples from both of you, and funding to go with it. That's excellent. Dr. Pletcher, how about what you all are doing?
Well, before coming to Houston, I came from New Hampshire, so did a lot of rural work. And I'll just say that from my perspective anyway, in terms of access to lots of different populations, I mean, we know that in fact our belief that only people with resources access digital just isn't right. I think even people who are homeless and down to their last dollar, we know they own cell phones. So bringing healthcare to something that's in your pocket. You don't have to have a door. You don't have to have a car. You don't have to be within striking distance of, a major metropolitan area packed with hospitals like the one I now reside. And I think some of the other features there are when you take away the need for transportation, you eliminate cost. You eliminate having to have a means for transportation, to be able to take time off of work, to what do I do with the kids while I go to my doctor's office? Discretion. Right? Like allowing people to have visits where they don't have the stigma of having to walk into a clinic that, they feel may give away the reason why they're coming for that visit. Being able to integrate translation services into visits. Being able to have your visit at home with your kid who can help you understand what the provider's telling you. I mean, there's so many ways that virtual is the opposite of excluding those populations. It actually, I think, is much more inclusive. And then obviously the biggest one to me is, anytime you have a digital environment, you can take little increments of medical expertise and make them available to anybody, anywhere at the time that they need it. And not just when they can make an appointment or go to a quaternary center, but when they actually need the care. So, that's why I'm so rabid about virtual and excited about having a platform that's going to allow me to use it even more than I already do.
Awesome examples. And, some of what you mentioned, for instance, like discretion, text is a very discreet way of being able to communicate someone. It doesn't require a lot of data. It's low, it doesn't require broadband access. And it's one modality of care that we can take advantage of to be able to care for folks who are historically under-resourced. So thank you all for that, that good note to end on. I really appreciate all of your time and your insights. This has been a wonderful conversation. Thank you to all of the attendees for spending some time with us today. We had almost 40 questions and we only got to one. So we will follow up with responses to the questions. We'll gather them and provide some, get back to all of you with some deliverables after this conversation. And again, thank you so much for joining us. Thank you, Wendy, Dr. Pletcher, and Madhur. I'm really looking forward to seeing how we can all continue to work together and evolve to serve our communities. And for those of you who did attend today's session, if you have any questions about Dexcare, you can find additional information at the website at Dexcare Health, DEXCARE health.com. And I think that wraps us up for today. I will hand it back over to Vanessa to close us out.
Thank you all so much. That concludes today's mHealth Intelligence presentation. Special thanks to our speakers, Sarah, Dr. Pletcher, Wendy, and Madhur, our audience, and our sponsor, Providence and Dexcare. Thank you and goodbye.